Hi, my name is Kristen Powell. I'm a nursing student here at South, and today I'm doing my medication administration checkoff. Here's my name badge. Okay, and now we will scan the room. Okay, so the first thing that I will do is make sure that when I'm preparing my medication, I'm doing it in an interruption-free zone. I'm making sure that I'm not taking calls on my cell phone or talking to a coworker unless it is essential to what I'm doing, and I will make sure that the door is shut. So the next thing that I will do is I have my MAR here and my patient care form here, and I will make sure that the order matches the MAR, and I will also look for the 7 rights of medication administration, which are the right medication, right dosage, right time, right route, right patient, right documentation, and right indication. Okay, so this is morphine sulfate, 5 milligrams IM every 4 hours, PRN pain. And this is morphine sulfate, 5 milligrams IM every 4 hours, PRN pain. It is for Jaguar J. Jones, August 25th, 1963, August 25th, 1963, and I will check to see if he has any allergies. And he does. He is allergic to penicillin and allergic to penicillin. So the next thing that I will do is hand hygiene. And then I will grab my vial and verify that it is accurate with my MAR. So I have my vial and I'm looking for morphine sulfate, 5 milligrams. This is morphine sulfate, 10 milligrams per milliliter. So that means since we need 5 that we would do half a milliliter. I will also check to see if it was expired, and this expires 12/20 of 2025, so it is not expired. So the next thing that I'm doing is verifying the time, and it is every 4 hours and every 4 hours. So I will make sure that the medication was not given less than 4 hours ago before I administer it. Okay, so the next thing that I'm doing is I know that I am doing an intramuscular, so I will use a 3 milliliter syringe. I have my blunt cannula here. And then I have my 23 gauge needle here. Okay, so first I will clean the top of my vial. Okay, I will grab my syringe. I will put on the blunt cannula in sterile technique, and then I will draw half a milliliter of air, which is the equivalent to what I need of my medication. Okay. I will then uncap it. Put that up. And now I am drawing up my medication. And I'm making sure I have all my air bubbles out. Okay. And I will recap using the scooping method. Okay. I will take it off. And then I will put on my needle using sterile technique. Okay. I will verify my calculations with another nurse if indicated, and then I will also show that it is half a milliliter of medication. Okay. Then I will put a tag identifying what the medication is on my syringe. Okay. And for the second check for accuracy, I will check my vial, my syringe label, and verify them with the MAR. So this is morphine sulfate. This is 10 milligrams per milliliter. So this is half a milliliter, which means it is 5 grams. And we have morphine sulfate, 5 milligrams, and it's IM every 4 hours, PRN pain. So So now I will take my paper, or my order forms, my vial and my syringe, and I will go to my patient room. Okay, so I'll perform hand hygiene, and I will verify my patient using 2 identifiers. So I will look at his name tag. I will verify his name is Jaguar J. Jones, and I will look on the MAR, Jaguar J. Jones. His date of birth is August 25th, 1963, August 25th, 1963. I see that he is allergic to penicillin, and he is allergic to penicillin. So here I would ask the patient what happens when he takes his penicillin, and if there are any other medications that he's allergic to that are not listed, as well as what his pain is on a scale of 1 to 10. So Mr. Jones, I see you're allergic to penicillin. Can you tell me what happens when you take it? Okay, and are there any other allergies that you have that are not listed? Okay, and on a scale of 1 to 10, how bad is your pain? And when he answers me, that's when I will continue administering the medication. So now that I am at the bedside, I will verify from a 3rd time for accuracy. I have morphine sulfate, and that is morphine sulfate. 5 milligrams IM every 4 hours, and this is 5 milligrams of morphine sulfate because it is half a milliliter, where 10 milligrams is 1 milliliter. Okay, so now I will explain the procedure to the patient, raise the bed up to a working height, and position the patient in the side-lying position because I am doing an intramuscular injection. So I will do it in the ventrogluteal, which is the hip muscle. So now I will put on my gloves. And I will put on my goggles as well. Okay. So to find the ventrogluteal injection site, you would put your hand on the you'll put your hand on the greater trochanter site. You will put your index finger towards the anterior the anterior superior iliac spine. Your thumb will be facing the groin, and your middle finger will be facing the anterior iliac crest. I will palpate first to make sure I have good muscle, and then I will get a cotton swab. And I will clean the injection site. Okay, and I will leave the cotton swab pointing towards the injection site so that I can reposition my hand. Okay, I will uncap the needle, and I will pull the skin, and I will inject the needle at a 90-degree angle. I am going to aspirate to see if I have hit a vein, if any blood comes out, and it doesn't, so I will go ahead and inject. Okay, and I will hold gently, discard in my sharps container, but I will not massage the area. Okay, and after that, I will put the gown back over the patient. I will position him comfortably, and I will raise the side rails back up and lower the bed to the lowest position. Now I will take off my gloves, glove to glove, and skin to skin. We'll also take off my goggles, and then I will document on the MAR. I'm documenting the injection site and what I injected, and then when I come back in and reassess the patient, I will assess how he responded to the injection, and that would be the right documentation. And then for the right indication for this pain, it is used for pain, and it is used for pain. And that will conclude my checkoff.